Hey listeners, Jenny here, and I have an invitation for you. Here is an opportunity to learn from somebody who fumbled their way into a full recovery from debilitating chronic illness, so I can show you exactly what it takes to get yourself into recovery without the fumbling mistakes that I took so long to learn from. If you're suffering with a chronic illness or hitting burnout, I know you want to feel energized, pain-free, and safe and trusting of your body. But if you keep fighting and pushing your body, overriding its signals, without learning how to be self-compassionate, to prioritise and listen to your body's needs, so you have lifelong and sustainable change, then you're not only going to stay sick, but you're likely going to get sicker and struggle more. There is another way. In this free workshop, 10 Steps to More Energy Without the Flare-Ups, I'm going to show you a radically different approach to your recovery, so that you can get your energy back and stay well for good. What would you do with your energy back? What would your life look like? All you need to do is save the date right now, 16th of September, and then head over to jennyadamscoach.co.uk/energy and join the priority list. Once you do that, there will be a bunch of support, bonuses, and case studies to help you along your way between now and September. Once again, that's jennyadamscoach.co.uk/energy. I'll see you there. This week, we are joined by Aisling Quiery. So Aisling is a GP, a health coach, and a Compassionate Inquiry Practitioner, and a psychedelic medicine guide. So in this week's episode, there are some really interesting talking points. She has recovered herself from long COVID. She's also been involved in a psychedelic trial working with fibromyalgia. And we talk a little bit about psychedelics and how they can help or not help with trauma. We also talked about how important it is, especially when you have a chronic illness, to be validated and be held in community. So I hope you find this week's episode interesting and enjoy. Thank you for tuning in to the Calm Your Nervous System podcast, where you will learn to regulate your nervous system, not just calm it. I'm your host, Jenny Adams, and I'm a somatic coach who has recovered from debilitating ME and trauma. Alongside my guest experts, I'm here to share tips, stories, and debunk jargon, what is somatics anyway, about how you can regulate your nervous system so you don't have to live with chronic illness, burnout, or debilitating trauma for the rest of your life. A joyful life is possible. So this week I'm here with Aisling, and she is, well, would you like to introduce yourself actually? Should we get started with a little intro? I'd love to hear your story, what it is you do, and yeah, we'll see where we go.
Yeah, thank you so much for having me, Jenny. It's lovely to be here. My name is Aisling Quiery. I'm a GP in the NHS, and I'm also trained in Dr Gabor Maté's Compassionate Inquiry approach. And for the last 4 years, so I started my Compassionate Inquiry training in February 2020. And for the last 4 years, I've just been doing a little bit of GP out of hours emergency work, but mostly I've been working as a health coach and a compassionate inquiry therapist, I guess, one-on-one with people, a little bit of group work and running a few retreats. I also worked last year with Imperial College in London as a clinical research fellow on their xylopane trial, which is the first clinical trial in the world giving psilocybin or magic mushrooms to patients with fibromyalgia. So really my interests are in adverse childhood experiences, childhood trauma, and how that impacts health and well-being throughout life. And I really became interested in this work because I qualified as a GP in 2016, and I was working in Scotland in an area of high economic deprivation. And I was running a clinic for people who inject heroin, and I was also running another community hepatitis C clinic. So I was seeing a lot of patients with addictions and multiple complex problems around chronic ill health, chronic pain, and mental ill health. And the medical model wasn't giving me the answers as to how I could best support or help these patients. So we were doing a lot of good work with these patients, getting them onto methadone and getting them into good housing and supporting them with support workers and interventions that were very powerful and very helpful. But what would happen is when they stabilized off heroin onto methadone, their childhood trauma would come up, the reason that they were using heroin in the first place. And I didn't have any answers as to how to support them with that. And that's when I came across the work of Gabor. And I became really interested, not just in his work on addictions, but more widely with chronic ill health and wellness. I saw a big gap between my medical training and how I was actually able to, what was actually being presented with patients. So that led me on a journey, really. And I also struggled with my own anxiety and insomnia, and was drinking alcohol, and was struggling with the stress of the job. So it was kind of a parallel process of me searching for answers within my job situation, and also my personal life, struggling in my personal life. And I ended up going to the jungle with Gabor, actually, to Peru, to work with Shipibo healers and ayahuasca in the jungle for a couple of weeks. And that was very impactful. And when I came back from the jungle, that was when I decided to train in Compassionate Inquiry. So wow. I think I'm at an interesting stage now, because I've gone back in quite recently to GP daytime work. So I'm now working as a GP locum in various GP practices in my local area. And I'm really starting to see how, even if it's possible, I think it is possible but difficult, how we can apply all of this amazing research and experience and expertise around childhood trauma and attachment theory and emotions and stress, and how we can apply all of that to what we're doing as doctors.
Yeah, and thank you for sharing that. And I just want to say from me, and behalf of probably a lot of people listening, thank you for doing this work in the capacity that you're doing it in, because I think there's a lot of us, I've been through chronic illness myself, that just don't feel very seen, understood by doctors, by their GPs. And I would love to hear, you mentioned a couple of times about like the limitations of the medical model. What is it you have noticed that you're kind of hitting up against that you would love to change?
Wow, that's a great question. So I wanted to share as well that I had a chronic illness in 2021. I became really unwell with fatigue and body pain and neurological symptoms, kind of pins and needles in my body that was diagnosed as long COVID. And I had that for really a couple of years. I was unable to work during the worst part of it. I was unable to work for 2-3 months. And then I did recover within about 8 or 10 months, but it was really 2 years before I was back to full recovery. So I've seen it from both sides. What I've seen that I would most like to change, well, there's a combination of a lot of different things, I think. So there is a real resource problem. And I think it's really important to recognise that the NHS is under enormous pressure. And I work with doctors internationally. So I run, along with 2 colleagues, I run a program for doctors on what we call trauma-informed medicine, or mind, body, spirit medicine. And that we ran our first program of that this year, and that was doctors from all over the world. And through the Compassionate Inquiry program, I also run a focus group for medical doctors doing Compassionate Inquiry, and that's international doctors as well. So this isn't just in the NHS. I think the medical system is under extraordinary pressure, and it's under-resourced, and doctors are overwhelmed. And I think doctors come into medicine, part of the reason they come into medicine is their own trauma. And what I've found with working with doctors, and certainly this has been my experience, it's like our nervous systems find a home in this culture and this work, which is very highly paced and stressed. And that's unconscious, I think. But what we find is that we're in this this environment that is extraordinarily pressured, that is familiar to us. And I think that's what draws us to it in the first place. So then we have this cycle where we're trying to fix people with limited resources in a highly stressed environment. And, what we know about healing is that it requires connection, and it requires attunement and presence, and it requires us to be in our parasympathetic nervous system. So it requires us to be in a state of relaxation. So the way that the health system is set up makes healing almost impossible. So So that is the first thing. There is a real systems issue. And I think when I present this work to doctors, the most common problem that I hear is we just don't have time to do this, And so that is an issue, but I don't think it's the only issue. I think there's an issue with medical training, in that we still separate the mind and the body, and we still have a very biomedical approach. So although in the world of therapy and coaching and trauma, we talk a lot about co-regulation and nervous system regulation, and the importance of emotional health and well-being, and how suppressed and stuck emotions impact on our health, and the huge impact that intra-utero and very early experiences in our attachment relationships, the huge impact that has on later life and health. That's really not talked about at all within medicine. We don't see the brain as a relational organ. We don't really learn very much about attachment at all. We learn about childhood development, but through the lens of milestones and, when a child hits particular milestones, not through what their brain needs in order to develop in a healthy way. We certainly don't learn about trauma. Still, when I talk to doctors about this and even speak the word trauma, many of them think I'm talking about orthopedic trauma, like a broken leg, for example. So there's a huge gap. Even if we did have the time, there's a huge gap in the training that we have. And then I think the other issue is that there isn't any emphasis on doing our own work as doctors and nurses. And what I mean by that is doing our own our own personal development work, and knowing where our own triggers, our own wounds, our own blind spots are. And that's extraordinarily important, because what I see is that doctors come in and they're in fixing mode. And that is an adaptation, and that is part of our own trauma, is that we could go into that more, but we get our validation and our place in the world and our sense of value from fixing others. So of course medicine is a great profession for doing that, but that gets in the way. So from my experience of being a patient, and I'll never forget the moment when I had lots of tests, I had lots of blood tests, I had an ECG, I had various tests, and I was told by my GP, who was really good. I mean, he was wonderful, he was very efficient. And he did all the things I would expect a GP to do. But he said, well, it's great because all your tests are normal, and that's very reassuring, which is what we do as doctors, because we want to reassure the patient that, that there's nothing serious going on, that it's not cancer, or that it's not something that's immediately life-threatening. And we see that as being reassuring. But of course, as a patient, when you're really sick and you can't get out of bed, I mean, I was bedbound for a couple of months. That's not what I heard. I didn't hear this is reassuring. I heard, oh my God, what's wrong with me? So
many of us hear that all the tests have come back as normal, therefore you must be fine. And then there's almost there's a lack of alignment there in, well, I'm very, very sick, like you said, but everything's normal. So what's going on? And then I think sometimes this can be where it's all in your head, you're making it up, stuff can come in. And I think just because the tests say that everything is normal doesn't mean that there aren't other possibilities. And I think, like you just said about the mind-body link, this is where the nervous system and the mind-body and all the somatic work can come in that's just ignored. And just because it's normal, it doesn't necessarily mean that everything is wrong, that there's nothing wrong.
Yeah, absolutely. And I think that's a really, really important point, because the tests that we do are limited and they're quite basic, so we can do a basic set of blood tests and we can do some basic imaging, but there's so much more to what is going on in the body than a few simple blood tests can show. So I think when we're looking at medically unexplained symptoms, as from the doctor's viewpoint, this can be frustrating for the doctor, because, and I understand this, like I really get this, you're doing your best for patients, and then there's something the patient presents with, and your training can't explain what's going on, and you just want to be there and help and to fix, and there's kind of nothing that you can do. So then, with the training that you have, so then we, as doctors, we step into this trying to reassure and make it okay. What we really need to do is validate and say, I'm so sorry that you're feeling like this. This is awful. And I can really see that you're really struggling. And these tests are normal, but it's because the tests are limited. It's not because you're not okay. In other words, medically unexplained symptoms really means the medical model isn't fit for purpose. And, I want to say that the medical model is very powerful. And of course, especially in the acute setting, the power of what medicine can do is incredible. But I think what's happening is we're taking a very disease-focused acute model and applying that to chronic illness and to primary care. And the model just falls apart then, because we have to go much further upstream and look at the conditions for wellness rather than looking at a sort of a disease-based model. And, we are moving slowly away from that disease-based model. So, for example, in Scotland, where I used to work, there are link workers where patients can be referred to do things that are much more mind-body based and much more holistic rather than just pharmaceutical intervention. But I think the fundamental understanding of health and well-being from the point of view of medicine has to change. And when it does, and when we look at health and wellness and illness through this mind-body lens and through this childhood trauma lens, so we can explain so much more about what is going on. And emotional regulation, stuck emotions, the gut-brain axes, nervous system regulation, all of these things are hugely powerful, hugely important, and don't have tests yet. Maybe there will be tests in the future, but I think that's not really the point. The point is that there is a lot that we can do as doctors, but that we don't have the training to do, and we need to be looking more widely and borrowing from these other fields. I think we're too stuck in our own lane, and I also get that. Yeah, doctors are really overwhelmed and they don't want to take on this new information because it's just another thing to do. But what I've noticed going back into GP is that prescribing and medicine management, so all the stuff that we do around medication, is hugely time consuming. We sort of accept that as normal, where we make a lot of phone calls regarding prescriptions, renewing prescriptions, doing tests around prescription. Like, there's a lot of work involved in that. And I would really like to challenge that, and for us as a profession to step back a little bit and say, well, there are other areas that we can look at. And if we're able to walk alongside patients and move them more towards healing in the long run, that is going to save so much time and so much resource. But when you're firefighting, you don't have that perspective. When you're firefighting, as we know from being in a state of fight or flight, our perspective shuts down and our perspective becomes narrow, and we just want to deal with the patient in front of us and move on and get all the prescriptions done. And it's really hard to think in this holistic way.
And that makes so much sense. And it's interesting that you say how much time it takes to actually go through all the prescriptions, because from someone that went through chronic illness for probably 5 or 6 years, it got to the point where I felt like I was going to the doctor, and other people might find this, and I'd go in and I'm like, this is what's on fire right now. I can't sleep, or I'm exhausted, or I can't get through the day of work without crying. This is the big thing, because you can only come with one issue. And then they're like, what do you want me to do about it? Do you want a pill for that? And it got to the point where I was on so many, I was like 24, 25. I was on so many different painkillers, and then ones to protect my stomach because I was taking so many strong painkillers and opioids and antidepressants and all of this concoction of medication. And it was when I took a step back and was like, actually, I'm giving all my power to the doctors as well to fix me, and not actually looking within myself. And I think it was at that point that I started to realize, like, I've got some capacity, I've got the ability to heal as well as just rattling around with pills. But yeah, I think that's a really good point with the capacity, the stress that the NHS and probably other medical systems across the world, because it won't just be people in the UK listening to this, are under. That how great would it be to take a step back? And as we know, within the nervous system, you're in that sympathetic fight, flight, narrowed vision.
Yeah.
Versus, can we take a step back and make this a little bit wider?
Yeah,
So,
absolutely.
yeah.
And I think from what I see, it's actually patients are leading the way in many cases, like patients like yourself and others and I've spoken to so many who just weren't satisfied with the medical model and were taking a lot of medications that had a lot of side effects. And really, their experience was of not going deeper and not really looking at the root causes of what was going on. And, it's important to say that a lot of patients aren't interested in doing this deeper work. And they just do want to take a tablet. And that's okay. I
And I
understand
was one
this
of them.
Yeah. And yeah, absolutely. And it's hard, it's painful to go back and look at what's causing stress in our life and the emotions that are stuck in our body and our childhoods can be really painful work, and it's not for everyone. And that's okay. But then I think it's important to explain to people and to be honest with people what the limits then of the medical model are. And we know that long-term pain medication is not an answer for chronic pain. And we have seen that in the opioid epidemic in the States. And I've seen it numerous times, patients getting stuck on antidepressants for decades when actually the evidence for antidepressants is very limited. And the evidence is really for over very short periods of time. So patients get stuck on these medications for really a long time and then can't get off them due to side effects. And I think it's very courageous for somebody to step outside of that model and to look for other ways to heal. But then you're on your own and, your doctor really isn't able to support you then. And that's very scary. So I think as doctors, I think we need to have a lot of humility and to be more honest about what we're not able to heal, which is a lot of stuff that we're not able to heal. And it's thought that, some of the work coming out of lifestyle medicine says that 80 or 90% of illness is stress related. We know that at least 2/3 of what presents in acute settings and in GP settings is medically unexplained in some way. So our model really isn't working, and we need to have the humility to say that, that we know a lot and there's a lot that we can do, but there's huge gaps. And how can we listen to our patients? And how can we learn from patients who have healed? And I have a friend, a wonderful friend, who talks about this very openly, so he won't mind me mentioning, but he really struggled with rheumatoid arthritis in his 20s, and he had inflammation in his joints. He put on a lot of weight because he was on steroids. He wasn't able to walk up the stairs to his flat or even open the door of his flat because his hands were so swollen and his joints were so painful. And he became suicidal and he wasn't able to work. And he decided to start looking at other ways to heal himself. And he did, through a mixture of, diet and, going to the jungle and movement and therapy. And he did a lot of other things. And he went back to his rheumatologist, and his rheumatologist wasn't really interested. And I find that fascinating because there's a kind of a lack of curiosity about when patients are able to heal themselves. And I think probably from that rheumatologist's perspective, it was just, oh, that's one patient less to worry about. Let me just keep going with my list, with my overwhelming list of many other patients that I have to deal with. But it would be lovely if we had a little bit more curiosity about, wow, well, what did you do? And could that help other patients? And, I also think it's really important to say that for people who are struggling and who have chronic illness, there's nothing that they've done wrong. And, it's not a case of that they haven't tried hard enough or that they haven't done enough to heal themselves, because I think it's, having been on the other side of that, it is so, so, so difficult to live with chronic illness. It's all encompassing. It can just be really hard to get out of bed in the morning, never mind try to put a meal together. So this isn't about individual patients not trying hard enough or not going off on a healing journey or not taking it into their own hands, because that is extraordinarily difficult. This is much wider. This is about how the system can better support and better learn to really work with chronic illness, in a way that's meaningful. And I think lifestyle medicine has been great at pioneering this, and in the States and certainly in the UK as well. It's doing that. It's starting to take a step back and look much more at what are the conditions that we need for wellness, and let's move towards those conditions rather than waiting for chronic ill health to arise and then manage the symptoms. So, there are moves towards this, but I think we need to be doing much more, actually. And again, I even don't like saying that because doctors are doing so much already. They're just working so hard and are so burnt out and are so exhausted that it's not, we need to do more as doctors either. It's like the lens needs to shift, and actually
something needs to change.
Yeah. And what I've found from, running these courses for doctors is that they actually, they feed back that their work becomes much more meaningful and enjoyable and rich and enriching when they're able to have this new perspective, because they feel more able, they're more able to help patients. And, what I've noticed is that one of the big pluses of taking this approach and doing this kind of work is that with patients, when patients, as often just want to be seen and validated, and they want to understand a little bit more what's happening within their bodies, So what I find is when I have these conversations with patients, and of course you can't do it every time, we're time limited and all of that, but maybe in one morning surgery and one afternoon surgery, I might have one conversation out of a whole surgery that involves like going a bit deeper and looking at childhood and all of that. And sometimes it doesn't necessarily take very long, but they can be hugely impactful. And what I find is that we often avoid unnecessary investigations, unnecessary interventions, and unnecessary medication. And that's really important for do no harm. So, for example, if I can think of a recent example, I had a phone call with a patient in the out of hours she was a middle-aged woman who'd had chronic abdominal pain for 5 years. And she was struggling with constipation and diarrhea and mostly constipation. And she was ringing up because she had some rectal bleeding that I thought was secondary to hemorrhoids. And I had a quick look at her history, and she had had numerous investigations for this chronic abdominal pain. And she was asking me, I think I need more investigations. I need an answer. And just by flicking through her notes, I could see that she had significant childhood trauma. And I just said to her, we know that the gut is really, really sensitive to what is going on emotionally and what goes on in the brain. And the gut-brain axis is really important. And the gut is very sensitive to stress. I'm wondering what's been going on in your life in the last 5 years. And her, the pain started when she had a number of significant stressors in her adult life. So I listened a little bit to that. And then I said, and our guts are also really sensitive to what happens in our childhood. And we know from all of this emerging data on childhood adversity that if you have stress in your childhood, it really impacts your physiology as an adult. And there was a moment where she was silent, and then she said, wow, nobody has ever had this conversation with me before. And I wondered if my tummy problems were to do with my childhood. And thank you so much. And I said, okay, great. Would you be willing to do some reading? And I recommended a couple of books to her. I think The Body Keeps the Score and Nadine Burke-Harris's book, The Deepest Well on Childhood Adversity, which is a wonderful book on toxic stress. And she went off and she said, okay, I'm going to go off and do that reading. And then she said, thank you. And she said, I don't think I need any more investigations, do I? And I said, no, I don't think you do.
Wow.
And this is the thing that I find over and over when I have these conversations. Doctors are afraid to have these conversations because they think they're going to open a whole can of worms, and they're not therapists and they don't have therapy skills. I didn't have to talk to her about any of the content of what happened in her childhood or the current stressors in her life. I didn't have to talk to her about the content because, as we know, trauma is what happens inside of us. It's not the event. So it's not actually necessary to talk about the event. Certainly not in the context of being a doctor, because we're not therapists and we don't need to be. So I didn't need to talk to her about the event. I needed to acknowledge that those events had happened and make the link with what was happening in her body right now. And she was enormously grateful for having that understanding. She was empowered to go off and do some reading. She'd been validated. She'd gotten some answers. She could stop chasing tests. And she didn't ask me, well, what do we do about this next? It was like, wow, okay, thank you. I get it. So I think doctors are a little bit reluctant to have these conversations because then their fixer comes in and they say, well, we don't know what to do and we don't have the resources to refer people and all of this. But what I've actually found is that patients are really grateful just to understand, to have an explanation.
Yeah.
And the work
who's got the power there as well?
Who's got the power? Yeah, exactly. Absolutely. And when we hand our power over to patients, it's less work for us because we are no longer the ones trying to sort everything out. And, and she is not going to come back. And she had a lot of different investigations, like investigations that I hadn't even heard of, So that creates a lot of work for GPs and for doctors in the secondary care system. So I think we need to get away from this, that it's all a big workload and that we need more time and all of that. Because in my experience, if we can have these little short windows of conversation, it actually saves a huge amount of time and resource. And patients are really grateful because actually, in the end, I think what patients want to know is what's happening inside my body and why.
Mm-hmm.
And if we can give them that explanation, that's huge. That's really huge. So yes, we can talk about interventions, but actually there's a lot of power in just having that conversation. And, we know this from the pilot studies that have been done on ACEs screening. So this is routine screening for adverse childhood experiences in the GP setting, that just having conversations about ACEs with patients is impactful in itself without doing anything else. So it's like the conversation is the intervention. Yeah.
Yeah. And even just bringing that to someone's awareness, like I didn't realise that some of my trauma that I'd been through was linked to me being in a wheelchair. Like they're completely different. How are they linked? And then it was only when I started to do my own research, I was like, oh my God, this is linked. And I think sometimes if you can just plant those seeds and then let the patient go and let them grow. And I think just in what you said earlier, that just validating the tests are limited. I hear you in your pain. I see you can be huge. And like you just said with that patient that you saw with the gut issue, she's probably left feeling quite empowered, like she can do something. Because often I used to chase the test because I was like, well, I need to do something about this. Well, how about you go and do some research? And especially when it comes from the voice of a doctor, that authority figure, I think, that can be huge.
Yeah, thank you for saying that, Jenny, because I think it's that we don't always need to have all the answers. We can, our role often as GPs is to kind of signpost patients in a particular direction.
Yeah, and then let them, be supportive, but let them find their own way and their own healing, because it can feel a lot more empowered rather than they found a thing and this is what we need to do about it. And I have no idea what's going on and why this is here. And, that could be, that's pretty scary to be in that place.
Yeah.
So
it is.
You also mentioned a couple of times, and I probably should mention, we met through Compassionate Inquiry, which is a incredible training with Gabor Maté. So I met Aisling at a retreat that you were hosting last year in Ireland, and we've both trained in Compassionate Inquiry. You've done the 6-month mentorship, haven't you?
Yes, I did, yes.
Yeah, which I haven't done yet. I've just finished my training. It's been incredible. There's been a lot of working on ourselves. And I think, like you said, with GPs, that's often one of the things that can be missed. But you also mentioned psychedelics, and a lot of Gabor's work, well, he came from working with addicts on the street. And I think you said you've come from a similar background working with people with addictions in Scotland. And I think this might be an interesting rabbit hole to go down around psychedelics, because you mentioned them a couple of times, and I'd love to hear more about this study on fibromyalgia. So I think when we spoke last year, you were going into it. So yeah, can you tell me a little bit more about psychedelics, who they work for, when is it appropriate, when is it not?
Yeah, gosh, that's a huge question. Yeah. Thank you for asking. Yeah. So yeah, let me see. Where do I start with that? Well, it can seem maybe, when you first come across psychedelics that like, what's going on here? This is a drug. Why would you be taking a drug like this to help people with illness? But actually, I would view it as a medicine. And there was a lot of research in the 40s and the 50s on when psychedelics were legal, looking at psychedelics. So in the Imperial College study, we would give patients a high dose of magic mushrooms, and they would go on a journey for 4 to 6 or 7 hours with 2 guides. And that journey would be, well, you could call it a journey or a trip, and come out the other side. And then they would have some support to help to integrate that journey. So psychedelics were then made illegal towards the end of the 60s. But there was a fair amount of work that showed that was sort of showing that they were helpful in clinical settings for all sorts of conditions. So the pendulum has kind of swung back the other way, and there's now a lot of interest again in psychedelics, and there's research happening in Imperial College London and in Johns Hopkins in the States and in many other research institutions for all kinds of conditions. So I mentioned that I worked with the fibromyalgia study, but there's also, working with psychedelics and addictions and chronic pain and alcoholism and PTSD and, all sorts of conditions. And I think why they can be helpful, and you're right, they aren't for everyone. So anyone who has a history of bipolar or any kind of psychotic episode or something like that wouldn't be suitable for psychedelics. But the reason that they can be helpful is they very much bring us into our bodies, and they really uncover unconscious memories and the unconscious, and they really open up new neural pathways in the brain and help us to think about things in a different way. So it can really help us to have a better understanding of ourselves and very early childhood stuff. And I think what's really interesting about psychedelics is that, there's studies in many different areas of health and well-being and mental ill health with psychedelics. And I think are proving useful in many of those areas. And I think what that points to is that the root cause of much of our ill health, biologically, it might show up very differently, but the root causes are often the same and go right back to very early childhood and these adaptations that we take on, the toxic stress and how that shapes our brains and our bodies. So when we sort of revisit those experiences in a psychedelic journey, it can give us a lot of understanding and can help us to start to make changes in our life. And it can challenge core beliefs that are very entrenched and rooted and that we believe are just the way things are. And when we take psychedelics and make new connections in the brain, we can start to understand that, okay, this isn't just how it is. That's how I thought it was. And maybe there's new ways of thinking about myself and the world. So they can be very powerful. I also see some worrying trends in the psychedelic world as well. And, I think we're in a bit of danger of going down the same route as, antidepressants, where this is just a medication that you take and that you don't need to do anything else. Psychedelics I see as potentially being powerful in opening up something, but then we have to go off and make sense of that and kind of bring that into our lives. And, therapy support can be really helpful and lots of other modalities that people find helpful for regulating the nervous system and for helping to heal, whether that's getting your hands in the earth in an organic farm or any kind of movement practice or meditation or journaling or community or, there's many, many ways that we can support ourselves to heal. And psychedelics is one of those. And I think there's a lot of excitement about psychedelics, which we could argue rightly so, but it's certainly not a kind of a cure-all for everything.
As someone who hasn't done any psychedelics, I'm seeing a big uptick in a trend of, it almost feels like go on a trip, you need some integration, but this will kind of fix your trauma.
Yeah.
But if you're going and revisiting a lot of childhood trauma, is that not really overwhelming and scary?
Yeah, it can be. It can be. So, and it's a great question. The set and the setting is gets talked about a lot in psychedelics, and this is really, really important. So so setting is our mindset. So it's good to go in with a particular intention, and we do need to be careful about who can take psychedelics, like I said. So I think there is a level of emotional regulation within ourselves that we need to be able to have in order to navigate a psychedelic journey. And then the setting is the holding of the facilitators and, the space in which you're taking psychedelics and all of that. So it has to be guided in a skilled way. Okay, it doesn't have to be, but the setting is important. It's important that it's done under guidance and that it's done with somebody who can facilitate and has experience and all of that, especially if there's a lot of trauma. But yeah, you're absolutely right. It can bring up stuff for people that can be really overwhelming and can re-traumatize people, I think. So if you're left in a situation where where, you know, a lot of your trauma is coming up and you're not supported or you're not held through that. That can be really, really scary. And this is where MDMA therapy can be really helpful as well. So MDMA, or, you know, it's kind of street name, I guess, is ecstasy, but MDMA is also being used a lot in therapy sessions. And that can be very powerful because it really opens up the heart, fills us with a lot of love, and turns down the fear centers in the brain, the amygdala, so that we're able to sort of revisit those early experiences with a lot of love. And it's almost like those experiences are wrapped in cotton wool so that they're much more gentle and we're able to go in and look at those. But you're right, people who do have high levels of trauma, sometimes taking a high dose of psychedelics is not what's going to be helpful for them. It is overwhelming. And I think we have to remember as well that in the jungle, where these plant medicines have been used by traditional healers over millennia, so these are the real experts and masters of how to work with these medicines. And I think there's a colonization issue here where, you know, the sort of largely white, largely male Western psychology medical model has moved in and treated these medicines as they would a pharmaceutical, and have muscled out largely the indigenous voices, which have a much more holistic way of working with these medicines. But in the indigenous cultures, it's actually, or certainly I can't say indigenous cultures, but I can say that with the Shipibo, who I worked with in the jungle, that it's actually usually, traditionally, it's the healers that are taking these plant medicines so that they can go into themselves and look at their own trauma so that they are then clearer and more able to better support their patients. So it's not that these medicines would be given to the most sick and the most traumatized. It would be given to the people who are working with those people. And I think that's really, really important because, you know, for example, many of the patients in the clinic that I was running who were injecting heroin just wouldn't be suitable for psychedelics, you know. They just have an awful lot of trauma, and it would be risky and extraordinarily unkind to then give huge doses of psychedelics to these patients and bring up a lot of this stuff. It would be overwhelming. So I think there is a place for them. I also don't think it's necessary for healing, and it's certainly not a fix. And we have to be careful about who uses them. And we just have to be careful that we're not handling these medicines or approaching them like we do a pharmaceutical, where you take a dose and then it fixes you and then that's it. You know, it's much more nuanced than that. And I think we need to learn and be humble and learn from indigenous cultures that have worked with these medicines for much longer than the Western medical model has.
And would you be comfortable sharing around integration? You said you were in the jungle for 2 weeks. Would you be comfortable sharing how many dosages you had in that 2 weeks? How much of it was integration and how much was actually tripping?
Yeah, so I mean, well, I definitely didn't view it as tripping. Yeah, it was very powerful. So we were there for 2 weeks and we had compassionate inquiry sessions with Gabor during the day, and he was then pulled off the retreat. So he writes about it in his book, The Myth of Normal. And
oh yes, I've heard this.
Yeah, one of the chapters near the end. So yeah, so I was on that retreat. So we had Gabor for the first few days and then he left, and then we had the rest of the facilitation team. And we did 5 ceremonies over 2 weeks. And, you know, I'm still integrating some of those. One in particular of those ceremonies, and that was in 2019 that I went to the jungle. So it can take years to make sense of these experiences and to kind of bring it into our lives in a meaningful way. And maybe it's helpful that I can give an example of one of the ceremonies so that people can kind of get a sense of it. Do you want me to do that briefly, if that's helpful?
Yeah, I'd love to hear.
So I really struggled with anxiety when I went to the jungle, and, you know, I would particularly have palpitations and like tightness in my chest, and I found it really difficult to sleep, and my mind would be racing and I would be ruminating, and I'd struggled with that all my life. And, you know, I hadn't really made sense of it very much. And in one of the ceremonies that I did, I went back through my birth experience, which was an emergency cesarean section where my mum was actually under general anaesthetic, and where they pulled me out very quickly because they thought I was going to die. They thought she was going to die. And then we were separated for the first week. So I really understood through that journey how much, and the journey for me was very difficult. I mean, it started off with my head being pressed really tightly from both sides, and I couldn't understand why. And there was a pressure in my head, and I started having mucus coming out of my nose and out of my mouth. So it was a very embodied experience. And I realized at some point, it's kind of funny with these medicines because you know that you're having an experience. So it's not like I was fully in it, but I became aware that I was in the birth canal, and I relived that birth, and all my anxiety made complete sense because I was born in a state of absolute terror, and then I didn't have.
And did you know this? Did you know that this was how you were born, or was this coming through? Well, what would you say?
Well,
the body.
It's a good question. So I didn't know how I was born until I was in my 30s and I was in medical school, and they asked us in an obstetric lecture, how were you born? And I was like, oh, I don't really think I know that. And then, but I remembered my mum showing me a scar from a section. So I knew that I was a cesarean section. That's all I knew. But her scar was like a horizontal. So it didn't go across from side to side. It went up and down. And that's because it was such a big emergency. They just had to like slash her open and pull me out. So they didn't do it in the normal way. But I didn't know that. I just knew my mum had this up and down scar in her tummy, and that's all I knew. And when I did that ceremony, I went back and I discussed with my mum in more detail, and she was able to confirm really from her side what I'd lived through in the ceremony. And
wow.
And this is something that I think we don't appreciate in medicine, that there is implicit memory, which is body memory. So my body and my emotions and my nervous system remembered that experience and was holding it as anxiety. I didn't have a cognitive recall memory of it, but my body remembered what was happening. So that really helped me to make so much sense of why I was anxious, because when I looked back at my childhood, I thought, well, my childhood was okay. I don't, the happy childhood challenge, as Gabor talks about. But
we do.
Yeah. But I understood then, wow, I started off in the world with huge fear and terror. And then my mum was under general anaesthetic, so I didn't get any skin to skin. And then babies, because it was the late 1970s in the west of Ireland, were just kept in another room. And my mum was in hospital for a week, I think. In those days, you were kept for a cesarean section for a week. She did breastfeed me, and I was brought through. She was the only woman on the ward who breastfed. And they brought me through, and I would be breastfed, and then I would be taken away again. And, that was like a model, I realized in another ceremony, for love in my life. Was like love appears and then disappears and appears and then disappears. And I'd struggled with intimacy and relationships in my adult life. So it all completely made sense. But I still carried a lot of that fear and anxiety in my body. And the first ceremony that I did in the jungle, I had an experience of, the healers singing. So they do these beautiful songs, these ikaros. And this song came out of the darkness as a pattern, as a shape. And it came into my heart, and it peeled this fear off my heart. And fear, like my heart is where I would experience a lot of fear. I would have palpitations, as I said. And it wasn't painful, but it was this fear slowly been peeled off my heart. And then the fear sat beside me, and I sat and had a conversation with the fear, which sounds really strange, but it's really what I lived in that ceremony was what would be called disidentification, where we separate ourselves from the fear. So it's not I am afraid, it's like there is fear here, and that we can work with it. And we know from Compassionate Inquiry that that the fear is a very young part, that we can work with that fear, we can talk to it, we can hold it, we can negotiate with it, all of that. And I had that experience where I wasn't my fear anymore. My fear was a part of me that I could interact with, and that I could talk to, and that I could be with, rather than being afraid of my fear and trying to get away from it and trying to push it away. By sitting with it and actually having a conversation with it in the ceremony, I was able to understand it. And of course, when we have understanding and compassion for fear, it immediately starts to relax. When we're battling with fear and being afraid of it and trying to make it go away, of course, the stress levels in our body are really high, which then perpetuates the fear. So then my integration work from that session was, in my everyday life, was to learn when the fear came, to recognize it as fear, that it's not who I am, to do compassionate inquiry sessions, to learn more about the fear, and then to find ways in my life to dial down the fear in my system, which for me was cold water swimming, a yoga practice, meditation, dancing, and various things that would help my nervous system to regulate, widen my window of tolerance, help me to be in a more balanced, regulated state. And then when the fear does come, which it still does sometimes, but I still think of that ceremony. I'm now much more able to go, okay, there's fear here. Hi, how are you doing? How can I help you? Let's sit together. Let's wait for you to pass. It's okay. Whereas before oh God, oh, I'm anxious, oh, and it would all ramp up. So, I still go back to that ceremony sometimes, and I still use that technique of sitting with my fear and hanging out with it, and having a conversation with it. So when you have these embodied experiences in psychedelics, it can be very, very powerful. And it's not to say that I couldn't have worked with my fear in that way anyway, but it's really helpful. It kind of accelerates the process, because you have this real embodied sort of image of sitting beside your fear. It's very powerful.
Yeah, and I'm hearing how integrative that experience was, but also from what you've just shared, a lot of, especially the sitting with the fear, sounds very similar to what we actually practice in Compassionate Inquiry. Yeah. And I have done this myself as a client. I have seen this in my clients as well, that when there's something that we deem as negative that we don't want, we don't want to be run by anxiety, we don't want to be run by fear, we automatically kind of go to the opposite. We push it away. We don't want it to be here. And it can be bloody scary actually sitting with it. And it's not just, okay, you're going to sit with your fear for the rest of the day. It's in small doses. And I think it's also good to notice that our nervous system will only let us feel what we're ready to feel. So we're only going to allow in a certain amount. But when we let that fear be here and we get comfortable, like the wave of that fear, it goes pretty quickly. And I see this a lot in my own work and with clients. And then we're not running our life running from fear.
Yeah, absolutely. And I think this actually applies to symptoms as well. And I think this is one of the things that I've really learned from this work is, as medical doctors, we try to make symptoms just go away. And we almost create fear around the symptom. And, this can apply to something like chronic pain is a great example, So I did a wonderful training with a physician in the States called Howard Schubiner, who works in the Mind Body Institute in the States. And he is one of these kind of pioneering doctors working around, the science of chronic pain. And he talks about the 5 Fs, which are being fearful, focusing, fixing, being frustrated with, and fighting. And when we do all of those things with something, like with any symptom, but with pain as an example, all of that creates so much more stress in the body and puts us in a much more state of high alert. And then, of course, that's going to perpetuate the pain, because part of pain is a warning signal that our brain is giving us when things aren't right. So if we're then in a really state of heightened fear and alert, then the brain and the neural circuits for pain are going to keep giving us pain because there's something wrong. And I think it's a really important difference between this healing work and the medical model. Medical model just makes symptoms wrong and just tries to make them go away. And we know from our work with Compassionate Inquiry, we don't make anything wrong. It's there for a reason. And by finding the reason and being open to learning from a symptom and what it has to teach us, we can be in much more of an open place of curiosity. And we can actually look at, okay, what has gone wrong in this system, in this person's environment? What were the conditions in their childhood? What has led to this symptom being here? What can we learn from this symptom about what has been imbalanced in this person's mind, body, physiology? And then how can that help us to heal, rather than we've got this symptom and we just want it to go away? That doesn't work. Like, we know that. We just mask the symptoms with medication. So I think in that little exercise of sitting with fear, we can apply that to symptoms as well. And, that's not to say either that we expect patients to sit with stuff, especially pain, when it's really extraordinarily uncomfortable and excruciating. And of course, we don't want people to be in pain, and we want to do everything we can to manage it. And we're not saying that we don't want symptoms to go away. Of course we don't. They're awful to live with, but it's just maybe coming at it from a slightly different perspective of, what is this showing us? And being curious about it, rather than there's something biologically wrong and we just want to fix it.
I found on my own healing journey that when I accepted the pain and I got curious about it and I stopped trying to make it go away, it went away as a byproduct. And it seems counterintuitive, but getting curious, letting it be here, actually works. But like you said, it's there for a reason, and it's not always someone's fault that it's there. but let's get curious with why it's here. What's it trying to tell you? It's just a message. And I think when we can, you know, we take the painkillers, we do the things, often making those symptoms go away is like playing whack-a-mole. You know, we get rid of one and it pops up somewhere else. And I've seen this in clients. They'll come to me with a bad knee and then it's their shoulder and then it's their back. And there's always something. You get rid of one and it's like, well, we've not got to the depth, the root of what's going on here. We're just chasing stuff around the body. So just to finish up, I have loved this conversation. This has been so interesting.
Yeah, thank you, Jenny. It's been great.
I've got one question. What do you wish that you knew at the beginning or a few years ago before you went through your own journey of being chronically ill? What do you wish you knew? What could you share with listeners?
My goodness, I wouldn't say before I got ill, before I had a chronic illness, because I think then I had a lot of the skills and the tools already that I was sort of able to apply. But I would say for when I was anxious, when I struggled with anxiety, because I struggled with anxiety really probably from early teenagehood, and I didn't really begin to even tackle it until I was 40. So I had decades of living with this, and I wish that I had known that there was nothing wrong with me, because I had a belief that there's something wrong with me, that there's something up in my body, that I've done something wrong, that there's something wrong with me. And that created so much shame and it stopped me from getting help. And I would love to have had the perspective, there's nothing wrong with me. This is about something that has happened. I don't understand what it is, but there is a way forward, and there is so much help out there, and there are so many resources. Some of it is really expensive, but not all of it is. A lot of it is free, and I'm sure that you have got a lot of resources that you recommend to people who listen to this podcast. But books, podcasts are a great place to start. Communities of people who can help. But I would really that's what I really wish I'd known. There's nothing wrong with you, and that can really change how we approach ourselves, because we stop this cycle of desperately trying to fix ourselves. And as we've just talked about, we go off in more a direction of curiosity. And what has happened to me? And can I understand this from like a wider perspective? And there's so much more information and resources now than there were 10 or 20 or 30 years ago. And it's entirely possible that people can heal from this, and that's not saying that it's easy or that people may not want to. And it's not saying that people aren't trying hard enough or aren't doing the right things. It's nothing like that, but it's just saying that it is possible, and that there's nothing wrong with you.
And what an amazing message to end on, that there is nothing wrong with you. And I also found when I have gone to spaces myself with that mindset that there was something wrong with me, and when I've also held the space for people that have had chronic illnesses, when you start to realise there's a group of you that all think that there's something wrong with you specifically, and you all feel the same, something shifts. Oh, maybe it's not just me. Maybe there's something bigger going on here.
Yeah.
And I think that can be a really big turning point. Yeah. So thank you for ending on that one. And I really appreciate you being here on the podcast. So for anyone that would like to find out more about you or work with you further, where can they find you?
Yeah, so they can find me on my website, which is www.draislinquiery.com. And
fantastic.
I do have a Facebook and an Instagram account, but I don't use them very much. But they can find me through my website and email me, and I'm really happy to answer any questions.
Okay, amazing. Thank you. And we will drop a note in the show notes as well.
Okay, great. Thank you.
Thank you.
Thank you so much, Jenny.
Thank you for listening to this episode of Calm Your Nervous System. I hope you found the conversation as interesting as I did. If you would like to start healing your nervous system, I have a free energy diary available just for podcast listeners, which will really help you see your blind spots about how you're spending your time and your energy. Find it at jennyadamscoach.co.uk/podcast. Find out more about me and somatic coaching in the show notes below. See you next time.